and we're live.
Good evening and welcome to members, officers and press alongside members of the public who will be joining this meeting this evening of Newham Council's Health and Wellbeing Board, which we're convening on Monday the 24th of July 2023, and membership comprises of representatives from the London Borough and also the Newham Face-to-Face Partnership. We are quorum in the fact that we've got 5 members of the board present in person, of which at least one representative is either from the London Borough of Newham or the Newham Face-to-Face Partnership Network. So we're going to be proceeding as planned. There was a short list that we may not be quorum. So my thanks to all members making the effort and the time to be here with us in person. Just be advised, colleagues both in the committee room and also colleagues on Zoom, that the meeting has been live streamed on the council's YouTube platform. And so my welcome to members of the public and also media that may well be watching, and also to members of the board and colleagues that are here observing or will be presented across the agenda items that we'll be discussing this evening. Please note that any member of the board unable to join the meeting in person is able to join remotely. However, they won't be able to move or second an agenda item or vote if a vote is required. And just with regards to the hybrid meeting etiquette, I'll look in the first instance to hands in the room, and then I'll work my way to the colleagues on Zoom. So the first thing I wanted to address was the matter agenda item 1, the election of the deputy chair for the municipal year 2023-24, as this is the first meeting of the Health and Wellbeing Board. On the advice and in discussions with the monitoring officer of Newham Council, I'm proposing to defer the election of the deputy chair for this municipal year until the next meeting of the Health and Wellbeing Board, principally because the cabinet member at Newham Council for Health and Adult Social Care is not present at this meeting this evening, and he was going to be the principal nominee, but it will be appropriate to nominate him in his absence. So I'm just going to invite any colleague from the board who's present in the meeting, if they would be willing to second my proposal, and then we can vote and then go on to other agenda items, unless anyone has any questions. Okay, thank you. Is anyone willing to second? Thank you very much, Councillor Joshua Garfield. So just going to vote on the deferral of the election of the deputy chair for the Health and Wellbeing Board for this municipal year 2023-2024. Do we agree? That's agreed. Thank you, Pauline. Thank you very much for that, Joshua. We're now going to be moving to apologies for absence. I'm just going to be inviting the clerk to the committee, Pauline Jones, to advise on formal apologies received.
I received apologies from Marie Truman Abel, Councillor Wilson and Councillor Khan. Councillor Ruiz is in the meeting next door and will try and join us if you can, but maybe unlikely. And I noticed there's apologies from Colin on that signing in Jones.
Okay, great. Thank you very much. Are there any other apologies that we need to note from any members of the present that they may be aware of? No? Okay, fine. Thank you for that. We're noting those. Oh, I can just see a hand up.
Yes, sorry.
Yeah, go on, please.
Thank you, Mayor. Just to mention that Tim and Vic are both on holiday, so apologies for them both as well.
All right, brilliant. Thank you very much. Great. So we've noted those two as well. Moving on to agenda item 3, which is declarations of interest, as set out on pages 9 to 12. In accordance with the members' code of conduct, this is the time for members of the Health and Wellbeing Board to declare any disclosable pecuniary interests or non-pecuniary interests they may have in any matter being considered at this meeting this evening, having regard to the guidance attached to the agenda. So I'm going to be inviting members first in the room to advise.
Thank you, Chair. The interest of non-pecuniary, but one of the items on the agenda for my portfolio is defending freedom. I think it's worth mentioning that I hold responsibility for that.
Okay, brilliant. Thank you very much. That's noted. Is there anything else from anyone in the room? And I'm just going to turn to colleagues who are on Zoom. Are there any disclosable pecuniary or non-pecuniary interests that you need to raise? I'm just going to see hands up. Okay, there are no hands up, so that's a no. Brilliant. And then moving on to the minutes, I set out on big page number 13 to 18 in the hard copy of the pack, and conversely, 13 to 18, I think, on the online pack. These are the minutes of proceedings of the Health and Wellbeing Board that were held previously on the 26th of April 2023. I'm going to take it the members of the board have read the minutes, and I'm going to be asking members in the first instance in the room that this is a correct record of proceedings that took place on the 26th of April 2023. Is that agreed? That's agreed. And I'm also going to just turn to members on Zoom. If you do not believe that the minutes as presented in the agenda pack are a correct record of proceedings of the Health and Wellbeing Board meeting held on the 26th of April 2023, could you kindly put your hand up if you don't believe that they're an accurate record? Right, there are no hands up. Start to committee. Thank you very much. Now we're going to be moving on to the substantive agenda items, and as a regular feature comes to the Health and Wellbeing Board, we have the update on the SEND improvement journey, and that's a standing item, pages 19 to 34. And if okay with the officers, I'm going to firstly invite the Cabinet Member for Education who leads on the SEND improvement plan member side to state any introductory remarks. Thank you.
Thank you, Chair. As has been a standing item for some time in this committee, SEND improvement specifically looks at tracking our progress with regard to the written statement of action, which was a statutory document submitted to the Department for Education last year as a result of a joint area inspection in 2021. We have made some significant progress in many of the 4 areas, or at least all of the 4 areas in part, at least, towards improvement. One of which, most notably this year, was the clearing of the EHCP backlog 3 months ahead of schedule. Once we have been able to do that by increasing resource on a temporary 1 year and then a further permanent increase of half of that going forward, we are therefore able to focus on the quality of those EHCPs and looking further into our quality assurance practices to ensure that the co-produced plans, both with the young person, the family, including the parent carer, health partners, the school and the local authority, actually deliver what it is that our person requires in order to thrive in their educational setting. Secondly, something that we've invested in quite substantially through our Capital Small Grant Programme, of course, was the provision of specialist places within the borough. We know that a number of our young people with SEND currently travel outside of Newham to their school or place of education, and we were tasked by the government with ensuring that we had those places within the borough so that that young person can, one, be a beneficiary of our inclusive education policy at Newham, but also be included as part of a young person in education that is close to their community, to their family, and can benefit from joint working between schools and the entire family of schools, be it, for example, for our enrichment program or other cross-cutting activities that schools share, like sport programs, etc. Now, given that we're focusing specifically on the quality, there is some detail in here, not just on the number of plans issued, but demand and recruitment for the positions that we budgeted for at a cabinet table last year to increase resource. It has been a particularly challenging recruitment market to fill all of the posts that we can advertise, but officers are steadfast in ensuring that the roles are filled, because without them being filled, we cannot meet the requirements that the government has set for us from the joint area, etc., etc. So that at the moment is a key focus. I think at that point, Chair, I'll round off and hand over to Jessica, who's far more versed than I am, to go through details and any questions that members might have between us. We'll do our best to answer.
Brilliant, thank you very much, Councillor Joshua Garfield. Jessica, over to you.
Thank you very much. So yes, just to say that we, the sort of external scrutiny continues for SEND. We're preparing for an inspection that it will take place in, well, possibly in the next calendar year, if not the next sort of two. And we have recently undergone our written statement of action monitoring visits with the DfE and the CQC. We also knew and put ourselves forward for a pilot engagement conversation, which is part of the new inspection framework, which went really quite smoothly. And just last week we had a visit from the DfE again, from the attendance advisor, with who are looking at the way in which we're responding to the new attendance guidance, but really kind of thoroughly explored the response we're providing in SEND. As Councillor Garfield has said, there is a sort of mixed picture in terms of our success in permanent recruitment. It is imperative that we bring in really good quality members of staff that are going to uphold Newham's vision and values. So if we're unable to, recruit in the first round, then indeed we go out. However, the sort of recruitment video that we've produced has really had impact in certain areas. So we have been able to attract some educational psychologists. 3 senior educational psychologists join Newham in September, which is no mean feat, because educational psychology is particularly pressured professional group, and there's a sort of national shortage. So that has been successful. And equally today, we onboarded our permanent statutory service manager, Cindy, who is now with us, and with years of experience and bringing interesting insights from elsewhere. So not a sort of perfect picture in terms of recruitment, but certainly we are making progress against those significant headwinds. I'm sure people have questions, so I won't talk too much, but I would just like to offer the board assurance that, having cleared the backlog, as Councillor Garfield says, we are absolutely focusing on quality assurance. The multidisciplinary quality assurance team are meeting and baselining quality against a new framework that's been established in consultation with the DfE. We have regular dip samples, advice givers in health and care, and within the council are quality assuring the advice they provide to put plan writers in the best possible position to write high quality plans. We've engaged in DfE workshops, officer training, and also practice learning conversations that are enabling us to target and tailor those individual sort of quality improvement conversations with staff where it's needed. And we're on an improvement journey. We've fully acknowledged that, although the recent dip sample did identify 2 outstanding plans in terms of quality. So those green shoots of progress are present. So I'll stop there. There's obviously a lot to cover, but I'm sure people have questions.
All right, brilliant. I'm going to open up to colleagues, both online and also in the room. Any questions? Yeah. Do you want us to get your name?
Hi, I'm Jason Swellens, Interim Corporate Director of Adults and Health. Thanks, Jessica. With the backlog cleared, does that told us anything about need in the borough that has been, I mean, I guess added any kind of granularity or depth or understanding of need within this group of children, young people in the borough, or is it pretty much what we had understood to be the situation?
Yeah, the sort of primary needs are predominantly autism at 48% and SEMH and significant, speech and language at 12%. So that kind of, it pretty much upholds what we thought. Pretty much. We have done work with the DFE. We're sort of subject to the Delivering Better Value programme in Newham because of the high needs deficit that we are in, and Newham, much like many areas, are now really looking at strengthening the ordinarily available early identification in schools and settings to sort of, identify and meet those needs at the earliest possible stage within what schools and settings provide ordinarily. So hopefully things don't escalate to the point where plans are needed. Some children will always need plans, but they should be the exception. And we're looking at within the Delivering Better Value within that sort of programme of work and that work stream, we are sort of looking at capacity building. So we're kind of increasing skill sets and understanding with a particular focus on those highest needs.
Thanks.
Is that okay?
Yeah.
Julie Powell, Helpwatch Newham. I'm really welcoming all the work that Borough's been doing. And it's great that this backlog is being cleared. How is it feeling for parents and children and young people? Because it was one of the areas of concern that was picked up as part of the joint inspection. I don't know whether any feedback has been followed through with them.
Yeah, absolutely. I mean, we work really closely with the Newham Parent Carer Forum, and the relationship with the forum has sort of really improved tenfold. There is a much stronger sense of trust. However, we know the national picture is one where parents and carers feel frustration in many regards, and Newham is no exception. So I think it would be fair to say, I'm trying to sort of sum up precisely what the forum recently said when they've spoken to the DFE, because of course they join our monitoring visits, our engagement conversations. They have a standing item on the agenda at my senior management team on a fortnightly basis. So that exchange of information is very much there. I think it would probably be fair to say that they welcome the improved timeliness, which has been in the top quartile since January 2023, since the beginning of January this year. They are absolutely in support of the additional focus we're providing to quality, and recognise that absolutely does need to, continue to be prioritised to deliver the best quality plans. And inclusion is an area that's coming up really often, that obviously children have the right to attend their local mainstream school, and that is another issue that parents and carers are focusing on. Post 16, you'll have probably noticed in the report, we've had taken a really strident approach to improving our post 16 offer this sort of calendar year, and that's included increasing post 16 places through commissioning arrangements, but also arranging a marketplace to raise awareness about what's available and amplify the voices of our absolutely phenomenal supported interns who have gone on to secure employment, who are travelling independently when that wasn't thought to be possible when they first joined the programme. So again, it's an area where there's more to be done, absolutely, and there are areas of quite considerable frustration, not just in Newham but elsewhere. But I think the pace of change and the grip of the change programme and what is required is providing some reassurance for parents and carers, and we highly value the support they provide to the partnership. You know, they are an absolute central element of the partnership, and we're very grateful for the time that they give us.
Thank you very much. Any other questions in the room or any colleagues online? I can't see any hands up. I've got a question. Just noting on big paper number 21, the foundational work, section 3.14, foundational work of the local authority said 0 to 25 redesign concluded in December, identified the need for 32 new positions to more adequately resource the system. And then if you go to 3.15, just now the recruitment underway since the start of this year, and a status update across those. I guess I've just got a couple of quick questions. Of the 32 new positions identified that were required to adequately resource the system, what's the number to brilliantly resource the system? And I'm being deliberately provocative here for a reason, which I'm sure you'll appreciate, Councillor Garfield. And then noting also that the resourcing is for a defined period of time. Given all of the great foundational work and shifting the dial work, early stages that's happening right now, how do we mitigate the risk of all of that unraveling because we're not securing the financing? And granted, there's conversation to be had internally as part of our budget setting, but conversely, there's conversation that needs to be happening systems wide, including with our school communities and our health partners in particular. So where are we at with that?
Just if I may, Jessica, because I think initially the question is about political ambition. And if we're to be ambitious about what we need to brilliantly resolve the service, I would probably say from where I sit as lead member, I would quite like to see the 17 be probably about 2/3 larger, with the proviso that usually in local government, whatever you ask for, you get half of that. So if you were to increase by 1/3, I think that would be a brilliant change in the level of delivery for residents, because you wouldn't just be increasing the back end and therefore able to process EHCP requests faster. And we know that over the next 3-4 years and beyond, because of the place planning assessment that we've done, the need will grow. So if we plan in advance that needs to grow, we're on the front foot in order to deliver the very best interventions co-produced with our health partners and give them the heads up a whole financial year ahead of requiring said speech and language therapists or special places to be funded partly by the health service. We couldn't currently guarantee to do that for every single family as soon as the inspectors come in, because we know, like any level of local authority, we are functioning within the framework. So we have to be intelligent, and that's part of the ask that we've asked for with regard to investment in the digital infrastructure that will allow us to be more intelligent about how we apply resources. But honestly, if we're talking about political ambition, I'd see a 2/3 increase in the team size.
That to arrive at the 32 or more.
The increase to, rather than requesting the money we requested last year at the 32 more members of staff, I would have requested additional 50 to 60 staff with the provider that we've got the full whack.
And then the activity of health partners in this space in terms of the equitable distribution or drawdown on that required resource. How are conversations presently, and what more do we need to mobilise as part of that systems wide effort? I'm also thinking in the context of the upstream early intervention approach, the more that you resource upstream early on, the better it is for the individual concerned and their families, not least the individuals being young people, children, that they will then transition to adulthood, and how we mitigate against the potentially and likely higher costs if we're not providing that supportive framework very early on.
I think part of that is investing the capital money that we have done and that we will continue to do in the places within the borough. It's significantly more expensive to find a place for a young person outside of the borough. Not only do you have transport, but those places are more expensive generally. Being able to provide them in-house and make them more affordable to us. It also means that we have more of a resource for that young person's need, as opposed to the infrastructure surrounding it. I guess the conversations with health partners, I'll bring you into because you're more on the cold base on this one. But one thing that we've only like touch explored, but I think maybe health partners might be welcome to hear some ideas on, is drawing down some of the resources the NHS has, both in their back office functions and their digital infrastructure, which is far more advanced than what we have at the local authority, and some of their specialist staff for a temporary arrangement. You can see from the recruitment figures, we are struggling to recruit in some positions. We are struggling to resource our digital infrastructure. That is something that I think that NHS, whether it's at the North East London Trust or more locally hospitals and GPs or health centres even, could help us to do, with the intention of what this board is, which is to bring the partners together and say, well, let's do this immediately, so that we know that in years' time, those positions will have been filled and the arrangement is temporary. That's something that usually, negotiation-wise, I think would take a couple of years. Perhaps the Health and Wellbeing Board could help speed it along.
That would be very, very good. Music to my ears, in fact. Jessica.
Yes, thank you. I mean, yeah, absolutely. The kind of funding arrangements are multi-layered. So, when we're thinking about opportunities for us to work together, have shared spaces, that's one of the areas of exploration with health in terms of sort of joint funding. And as Councillor Garfield sort of rightly says, if we want to deliver efficiencies and stronger and smoother systems, then the sort of case management and IT infrastructure around that is absolutely essential. We know, I mean, it's sort of writ large on the report that need is increasing, the number of EHCP EHC plans is increasing. That will have an impact on the high needs budget, which of course at the same time we are understandably under considerable pressure to reduce and to deliver cost avoidance, and really think sort of carefully about how we're kind of allocating our resources. So there are, as ever, competing priorities. I don't think our NHS colleagues would mind me saying on their behalf that we are sort of all in agreement that capacity building in our local schools and settings is, sort of the right move, both financially, but also in terms of kind of delivering best possible educational life outcomes for our children and young people. And that will take some front loading of resource, to ensure that we have adequate speech and language therapists going into schools and settings, quality assurance of the education that our children with SEND are receiving, in those local schools and settings, because we're at a point in many schools and settings where 40% of the pupil population have or have ever had SEND, either at a SEND support level or with a statutory plan. So we're at the point where sort of that kind of mainstreaming and sharing those skills and upskilling capacity building is just an absolute must. And we're in many ways, the education we provide our children in Newham is absolutely phenomenal. But there's something about kind of rising up to meet the demand that we see at the moment.
Thank you very much for that. Right, so everything that's been said, and I've got a proposition and a challenge to the Health and Wellbeing Board, because we all accept that we don't want to be a neighbour gazing talk shop. So it'll be really, really helpful if Josh Worley could corral all of the health partners, because I'm sure there's been some of the really important and the basic work that's been done with Jessica and the SEND team internally, to just come back to a near future, maybe not the next one, but the one after that, with a series of options or scenarios. How much it will cost for the full complement of 32, and then the ambitious ambition of 50 to 60, not least because of the growing demand and everything else that we've said as part of that system approach. so that we're clear as a board as to the spectrum of possibilities, but actually how we use that advocacy role and the convening of members under the auspices of this board to nudge people, well, actually not nudge. Use a hammer to get them moving in the right direction, because we, we'll be all serving our young people, and we have a stated intention that we want Newham to be the best place for all young people to grow up and to thrive, and that must include our young people with special educational needs.
If you wanted the Defence Department, between myself and Jessica, the cost, essentially the dream service, I think we could probably do that ahead of the next Health and Wellbeing Board meeting. Second to that, an offer from my health partner on what it is that they could offer us on, let's say, for example, an interim period up to and including the inspection by the joint area. As Jessica said, we expect it within the next calendar year, so we're looking at a 12-month temporary arrangement, whether that's half a member of staff, a full member of staff, or more, or even an alternative set of resources like space, whatever that might be. If those options could be brought at the same time, that would be incredible.
Okay, super. And then that presentation could then lead to the more detailed, conversations with health partners, and then a subsequent meeting around over each financial year what's possible and how much further they could go over a 3-year time frame. Well, yeah.
Jessica, how does that sound?
Great. Yeah, absolutely.
Brilliant. Jessica is smiling, so I'll take that.
Prospect of additional resource always makes me smile.
All right, brilliant. Okay, I can't see any further hands. I mean, are there any health partners that want to say anything? We're all very silent at the moment. Nope. Okay. I'm going to take that silence as an affirmative yay. I'm really enthused by it as well. Okay, so we're being asked on this report, big page number 19, recommendations 2.1, the Health and Wellbeing Board are asked to note the progress made against the written statement of action and the areas of risk and challenge. I'm going to introduce an additional recommendation, which will be the Health and Wellbeing Board anticipate further updates over the next 4 months with regards to resourcing the required increase and the optimal resource requirement to have the best world-class service in Europe for our kids. Yeah? Is that okay for you?
I support most of that.
Okay, super. Right, do we agree about that? Yeah, we agree. Thank you very much. Let's move on to the next agenda item, which is the North East London ICS overview of the joint priorities groups and priorities. So this is, I'm gonna just quickly go to it. Just give me a moment, please. So this is Marie Truman Abel, the new director of the she's not. Oh, she's not. It's you. I am so sorry. Over to you.
Yeah, so I'm Jo Fraser-Wise. I'm the other half of the interim director of delivering the healthcare partnership within the integrated network. So very quick overview, I think, because it's fairly succinct paper. So the integrated care board has been around now for 12 months, 1 year on the 1st of July. And as a partnership, the Newham Healthcare Partnership, we've been doing significant work to move from our vision, which has been established for some time, into a set of very clear aims and deliverable priorities. So we've established governance, which supports actually part of what you said in the last item. So we have a babies, children, and young people joint planning group, where some of these conversations can take place. Each of the joint planning groups have a number of set priorities which are laid out in some of the appendices. They are in turn supported by things like the health equity programme and additional programmes such as Newham and the Rough Sleeping Board, all of which is trying to move us within Newham into doing some doing. strategy, so delivering on a set of priorities which make tangible differences for our residents, supported by an outcomes framework, engaging and involving residents as we do this, which we've got a lot more to do on. Some of the joint planning groups have residents sitting within them. We've also within North East London Integrated Care Board been holding what we call a series of big conversations, and the new one took place 2 weeks ago, where we were in Stratford Hall, and a number of residents came and talked through what their issues are within the health services, and that will inform some of the priorities that we're doing and shape that going forward. So what you've got before you is the sort of first cut. This work continues in terms of honing this down to make sure that, say, residents, it's the right things to do. Obviously, some of these things will get delivered, and then there'll be other things in the pipeline. And it's very much about making this tangible and real, as well as picking up what we know are the big ticket items like population growth. So we're happy to take any questions, or if anyone else would like to.
Is there anyone else from the partnership that would like to add anything outside of the introductory statement remarks? No? Okay, now are there any other questions that wish to be asked about the priority of the government's plans? Yeah, go on, Jason.
I guess it's just so I mean, I'm very much part of the partnership. I sit on the partnership board. I chair one of the joint planning groups on 80 Well, and in a sense, the joint planning groups provide the vehicle for us as a partnership to work together on improving different aspects of our delivery. So, you know, on 80 Well, as you can see in the attachment, you know, we're focused on the dementia pathway, on the falls pathway, working on frailty, etc. So there's that internal discussion within the Newham system on how we improve our pathways. The other thing is that question about the resourcing for Newham and how we make that real case for adequate resourcing for Newham. And I think it's something we've been talking about for quite some time, and don't think we have worked out an answer as a partnership about how to really resource the work necessary to baseline kind of what's needed for now, let alone what's needed to get our borough ready for the growth that we're going to be experiencing over the next 5, 10, 20 years. And we know that, you know, yeah, as we know, we don't have adequate resources for now. So I guess putting it out there, I think it feels like we're making progress on the kind of the pathway work within the resource envelope that we have, but not yet on some of the kind of longer term questions about resourcing and how we do that piece of work to establish a baseline and future needs. What do you think, Joan?
Yeah, I think you're right. I think we haven't got into those conversations in enough detail. There is now within the Newham Healthcare Partnership a finance group which is bringing together all of the partners to start looking at some of that. And the idea is it's not back and forth. It's exactly what you say. It's forward and looking and understand what's the totality of our spend, what do we need, what does that mean for the rest of the system. Yeah.
I wonder, Roxana, whether we could task that finance group to come back, maybe not at the next board, maybe the one after that, with a kind of status update on that work. What do you think?
Yeah, I'm happy with your recommendation, because it also dovetails quite neatly with the conversation that we had with the previous agenda item. Yeah, so I'm happy to accept that as a recommendation for a suggestion. Are there any other questions? Yeah, Councillor Garfield.
Thank you, Chair. forgive me, because I feel as though the language implies this in the plan of priority, but it's not explicitly stated. I wonder if there was a reason, and that is that it currently makes no explicit reference to the importance of active travel in the health and public health of our residents and of society. And I think that in any and all of the borough's active travel initiatives, public health and this healthcare partnership vision should be at the core of that, because it is something that we know as a borough we have too much of a sedentary population. We know the effects of walking, cycling, scooting, moving actively in any way within the community, the hugely beneficial effects that will have on one's health. And I think if that were explicitly highlighted as a core partnership aim, or at least part of the vision, that could benefit us.
Yeah, I agree. I'll just made a note to add it.
Brilliant, thank you.
Anything else, Jason?
Generally, I mean, there's a lot of things, generally speaking, the way I think about the distinction between the kind of the health and wellbeing plan, which is the 50 steps, and the health and care partnership, which is more fully focused on the kind of clinical, the health and care pathways. So for example, we have, all of the members who adopted the 50 steps. So I don't know, Tom Ellis, who's on the call from New University Hospital, who's working on how to map all of those things like active travel onto the work of NUH. So I think that stuff is in here. I think it's just more, it's more about the partnerships buying into the 50 steps rather than in this plan, which is more about clinical pathways. In the place where it interfaces particularly here is the wellbeing and prevention piece, which is how people, where they're being supported by healthcare system, are supported to be active and do those other things which are supportive of their wellbeing.
Yeah, but and I agree, and I think as you said about Jason, I think we can do both of those things. I think that's a gap in the end, so there's nothing that very much there about working for so you could encourage something which captures both of them.
Anything that I mentioned, anything that links to activity as a whole, or the leisure of or people that refer to cases as well. Because there's other things in here that are quite obviously and very welcome, namely about prevention and the pathways.
Okay. I can't see any hands up. Is there anything? No? Okay, fine. So let's move to the recommendations on agenda item 6, which are on the big page number 37. The Health and Wellbeing Board is asked to note the emerging plans for the new health and care partnership and provide input into the support towards the plans, which we do on an ongoing basis in any case. And just an additional recommendation to agree that following conversations with the new health and care partnership, an update will be provided with regards to the work of the finance subgroup at the next meeting of the Health and Wellbeing Board. Yeah? Great. Have you got that? Yeah?
Yes, so not this next one, but the next one in October.
When's the next one?
The next one is October.
Yeah, the next one.
October.
Yeah.
Okay, do we agree?
Yep.
Agreed, that's all agreed. Now we're going to be moving on to the next agenda item, which is the agenda item. Right, agenda item 7, which is Newham's place-based carer strategy year 2 progress report. And I have the following listed: Annalise, Senior Commissioner, Adults, and I'm so sorry, Hannah, if I've messed up your surname.
No, that's perfect. That's fine. Thanks.
The Wise, that's you. New Director of Delivery, and then Debbie Hostins, Commitment to Carers Regional League of London NHS England. So who'd like to go first?
I can kick things off if that's helpful, and then I'll hand over to Debbie and Jo as well if she wanted to add anything.
Go ahead.
Fantastic, thank you so much. So yes, my name's Annalise. As you said, I'm Senior Commissioner, and I'm leading on the delivery of our place-based carer strategy here at Newham, working with all of our partners. So just very quickly, by way of introduction, just wanted to be very clear that when we're talking about carers in this context, we're talking about what many people often call unpaid carers. So those are the amazing friends, family members, neighbours who give their time to care for some of our borough's most vulnerable residents. The 2021 census data was released earlier this year after a few delays, and it told us that there was around 21.5 carers living in the London Borough of Newham. But we, in fact, think that's fairly significantly underrepresented. We think there's a lot more carers than that in the borough. A lot of our carers are hidden. They don't recognise themselves as carers, so they don't record in a lot of that data. And as we set out in our report, we're doing a lot of really exciting work with the discovery team at NEL at the moment to look at how we can better integrate health and social care data across the system to get a far better understanding of our caring activity across the borough. So as we know, carers come into contact with pretty much every part of the health and social care system in some way. So our place-based carer strategy that was signed off by the Health and Wellbeing Board 2 years ago sets out a single ambitious vision for how we're going to collectively identify and support carers from the age of 5 upwards in the borough to enable them to maintain and manage their caring role where they choose to do so. It should be noted that the cost of not supporting carers can be very, very significant. So the latest projections from the Carers Trust estimated that the average carer in Newham could be saving the local health and social care economy in the region of potentially £39,000 per annum. So that's costs as a social care economy and health economy that we would need to be picking up if those carers weren't doing what they're doing. So you've got a copy of the Year 2 progress report. I won't go through that in line by line, but just to summarise, I suppose, some of the main points over the last year. At this point, we've completed fully 14 of the 29 actions, so that's just under half, 49%, that were due to be completed in the first 2 years of delivery. It's worth mentioning that the other 15 are fairly chunky. There's some really big ones in there that require quite a lot of system and culture change. And so I'm pleased to say they're well developed, but we need to do some more work to get those fully signed off. And in the main, as set out in the report, a huge amount of our time and resource over the last year, so in Year 2 of the strategy, has been focused on completely remodelling and retendering our commissioned carer support service, which went live on the 1st of May 2023. So that's a Better Care Fund funded service that we manage here in the council on behalf of the partnership. All across the whole of the work, this was really closely done in collaboration with carers themselves. So carers were involved in co-producing our new outcomes-based service specification, designing the method statements for the tender, and we had a dedicated adult carer and young carer panel that evaluated the bids and made up around 50% of the overall quality marks for the service. So we have the previous contract was delivered by quite a large national charity, and we're really pleased to see that it's actually just been awarded to a partnership of 3 really well-established local providers who are coming together to deliver the service for us. 1 second. And early indications are showing that it's embedding really well, not just within our social care and council systems, but within our community and health systems as well, and delivering a really strengths-based service, which we're really pleased about. We'll be able to give a fuller update on how that delivery is going in coming months. But one of the main things there is we've remodeled the service to make sure it really aligns with our strategic objectives, and will add some real weight to pushing those forwards. When we remodeled the service, we also secured funding from Cabinet to continue delivering a Carers Small Grants programme, which aims to really continue enabling and empowering the amazing resident-led carers groups that we have within the borough that we're really lucky to have. So we're going to be continuing to run that programme, and the second round is commencing shortly. And then, yeah, as kind of set out in the report, we've done a lot of work over the last few months to review our action plan 2 years in, to make sure that it's fit for purpose, to make sure that it's working correctly. And we've created a new governance structure with a range of different subgroups. There's a few people on the call today, actually. I can see Tom's here from the hospital. We've got a hospital subgroup. Now to really make sure that we're embedding across the whole of the system and get a really multi-agency focus and grip. I'll pass over to Debbie in a second, who will talk a little bit more, but just to kind of say, it feels like the governance we have in place now is putting us in a much better position in terms of aligning our strategic work at a place level across the system, and aligning with the NHS long-term plan as well, which Debbie will talk about, no doubt, in a second. So yeah, I think that's a whistle-stop tour of kind of where we are from my perspective. Happy to take any questions or any clarifications, but I might just pass over to Debbie Hustings, if that's okay, to add a few words. Debbie, as mentioned, works for the Commitment to Carers programme at NHS England, and has been really helpful working with us at a place level to look at how we can better link in with all of the stuff that's happening nationally and at a systems level across health. So I'll quickly pass over to Debbie, if that's okay.
Yeah, that's totally fine. Debbie, over to you.
Thank you very much, and thank you very much, Hannah. It's an absolute pleasure to work with you too, and all the team at Newham. My name is Debbie Hustings. I am a carer myself of nearly 3 decades of caring, but it's also my privilege to be the NHS England London Region Unpaid Carers Lead. I'm actually on secondment from Surrey Heartlands, but I'm thoroughly enjoying my time working with my London colleagues. As Hannah's alluded to, my role is about working with all partners to develop an integrated approach to supporting carers. And I think our ambition, and I don't think Hannah will mind me saying this, is to make London the most carer-friendly city in the world. I do this in a number of ways, partly around my focus on delivering the long-term plan commitment to carer objectives, and also the new carer duties laid down in the Health and Care Act 2022. But I think it is fair to say that it is the strategic relationships that will deliver on that wonderful ambition for our important carers. And this is why, because everywhere else in the UK, just Newham is just like everyone else. It all runs on its unpaid care. They are by far our largest provider of care, but we don't see them as a care provider. And as we've just heard from Hannah, the new census data does show that there's been a modest reduction in the number of carers, but the number of hours that people are now caring has significantly increased. So I've had the privilege of seeing data over 3 decades, and I can tell you back in sort of 2001, we were typically looking at people caring for 1 to 9 hours a week. Now it's quite normal to see people caring for 50 hours a week. And we know there's a direct correlation between the hours people care and their own health. And it has been calculated by our friends at Carers UK that to replace that care would cost the London economy 18.9 billion. It's just such a staggering amount. And yet we invest only a fraction of that in carer services. And as Hannah's alluded to, there is a real invest to save here. The more we look to support our carers, the more upstream savings we'll make. So it really does make sense to support carers. So we know from the census data that roughly 6% of Newham's total population are carers, but we also know from the GP patient survey that actually that figure is probably closer to 16%. So I think Hannah's right to caveat the data. I was hoping I was going to be able to share with you the latest 23 GP patient data tonight, but unfortunately it's been delayed to publication next week. But I think regardless of which data set you go, the 6% from the census or the 16% from the GP patient survey, you're talking about a significant population cohort for Newham. And actually earlier in June, the school census data was published, and this evidence really some shocking data. We have only 29 young carers in Newham against a population of 63,000 pupils. And this evidence an even wider gap, as we would expect that figure to be closer to 10%. So our kids that care are really flying under the radar. I quite like Hannah's expression that they're hidden. I don't suppose they're hiding behind the sofa, but it's obviously clearly important for us to do better through all our systems to identify these kids to care. And this is why data matters, and it is the cornerstone of this carers strategy. I think the Newham Carers strategy is a brilliant piece of work, and has all partners sharing that responsibility to support their carers, because none of us can do that alone. And this is why it's also really important that the work that Hannah and her colleagues have been doing to develop a carers dashboard, which will provide real assurance that those targets are being met. And interestingly, last month, the Health Foundation wrapped up a piece of work in Northwest London, where they looked at they did some data mapping between health and social care, and they actually found the overlap was only 2%. Now, this is really important, because it means that we in health know different carers than you in social care, but actually we both need to know each other's, and arguably we need the voluntary sector data included in there as well, to really provide a whole systems approach. I've been working with Hannah and colleagues to ensure the new strategy reflects the joint approach, and ultimately we want carers to move through our services in the most seamless way possible. Caring doesn't stop at the exit hospital door. The governance that Hannah's talking about, and where carers sit at place, now feels really far more robust, and it is now feeding into the North East London system working. And I'm pleased to share that the maturity of that system working has progressed faster in Nell than any other system in London. And that's evidenced very clearly in their recent publication of the integrated care strategy, which had no less than 27 mentions of carers throughout. So carers were really well embedded. And I think some applause to Hannah and the team here in Newham for really ensuring that rigour is in place for the system working. We also received the NHS England Carers Maturity Matrix return back in March. This draws together all the different work which is going on across the systems to support carers through the work programme. And it would be true to say that Newham is an exemplar place within the NEL system. We also had data sets now around number of carers registered with the GP carer code. We use something called SNOMED carer codes. We're now able to extract that data, and we know across the NEL system we have a population of just over 50,000 adult carers registered with their practice, and 1,325 young carers. Now, I can't extract for you the Newham data yet, but I should have that ready for Hannah by the end of August. We're able now to extract that from the core GP contract data. So this, I think, will be really helpful in feeding into the dashboard to map trends and progress, and I think will be very important in providing some assurance that the work is cross-cutting across health and social care. And a couple of other areas just to bring you up to date on. So we have taken two pieces of work to develop at a regional level. One is around carers and hospital discharge, and one is around carer contingency planning. Tom knows all about this. I see Tom's on the call. He will be fully conversant with Section 91 of the Health and Care Act. And this requires hospitals to put various duties for carers in terms of hospital discharge. And our clinical quality director is currently now out visiting all hospitals across London to see what progress they're making on implementing the carers in hospital discharge toolkit. So that really is very exciting. And I know Hannah's been working with Tom and colleagues too. The carer contingency planning is largely going to be delivered through integrating it into the new Universal Care Plan. So this is a digital record which is accessible to urgent care practitioners. We hope that carers don't have an emergency themselves, but it is clearly very helpful if they do have an emergency that urgent care practitioners can access their contingency plan to avoid 2 people coming into hospital. We are currently designing the service specification for the tech build. That's due by the end of September. And at the same time, those records of the current Universal Care Plan patients will be transferred onto the NHS app. Now, this is exciting because it will mean for the first time, people will be able to have read, write, edit ability. And in the fullness of time, carers who have proxy rights will be able to edit their own carer contingency plan on that digital platform. So as you can see, a lot of work is going on. We couldn't do it without the fantastic strategic partnership working with the new carer strategy group and with the great leadership that Hannah and her colleagues have provided us. So I hope that provides you with enough detail, and happy to take any questions.
Thank you very much. Is there anything else that you want to
No,
add? Yeah. All right, super. Are there any questions that any colleagues on Zoom may have with regards to what they've heard? Can't see any hands go up. Are there any questions from any members here? Yeah, go on. Yeah, please.
So thank you. That's really exciting and really welcome all the work. I was interested in the comment about the number of hours that carers are providing, and I think the number 50 hours a week was mentioned. So is there any work that's going to be done about possibly supporting some of those carers to apply for something like carers allowance? Has that been built into, because that's part of, I would imagine, the empowerment, recognition of carers raising their profiles and things like that?
Yes, absolutely. Yeah, just as you said, Julie, that's there's different parts of the strategy, but obviously one of the main things is identifying those carers, and then within the strategy there's a really clear pathway and different types of support that we'd want to offer carers, and all of the things you just mentioned around access to benefits, access to statutory carers assessments. So it's kind of financial and emotional and practical support. There's kind of a whole package that we're putting in place. But yes, that would definitely be covered.
Yeah. Any thought? No, you don't sound it.
Well, it would be good to get a sense of the numbers of people that have had to step up their caring responsibilities. But I just think the balance with cost of living complexities and access to statutory universal services is going to be harder. So actually, if carers are having to increase the amount of hours of support, it would just be good to have a better understanding in terms of population need.
I think that's a really, really good point. And could you just actually, in summary, advise what's the baseline evidence piece that you're utilising in terms of understanding the need characteristic of our communities locally, notwithstanding everything that's been said about, you know, in the context of the North East London partnership, you know, it's pioneering or, you know, excellent, but we can always do better. And certainly from my vantage point, that's really great to hear, but I know that we can do better. And I say that from the experience of being a young carer myself,
Mm.
the age of 11, and had I even had third, no, even a iota of support as I was growing older and into my late adolescent and then early adult years, that would have been really, really beneficial. And I guess the reason why I work so hard now, I don't know how to relax. But similarly, you know, I've come across over the years, particularly in different cultural contexts, and for residents, young and old, of different ethnic groupings, you know, the challenges of one, asking for help and issues related to stigma, but also being able to navigate the system, which can be quite hard. And I'm sure many of us in our different ways have had conversations with carers that have really struggled and haven't revealed actually the depths of despair and struggle that they've had to go through. And then I think it follows on from, I mean, so there's one question, i.e. what is it that you're using? What more is it that you need to pull together around that? You know, the research that's out there, or do we need to think about commissioning more research? Not least to get the depth and richness and texture required. And I say that having led a national research team looking at 13 different ethnic Muslim communities, and that took us 2 years to really get to the detail of how communities felt, you know, and interacted with public sector. But just given the dynamic nature of change in Newham, and then the intergenerational, well, you know, the different age cohorts, and actually as you follow carers throughout their own cycle, because I imagine the support required for a parent with caring responsibilities of a child is very different to the parent that has to continue that caring responsibility as their child becomes an adult, and when they become more vulnerable themselves. And then the second question was, how far advanced, given everything that's been said, is the practice development within the system? How is that advancing? Because you need to learn this, how to do it well. And this report, I mean, it's great. It just sets out actions in a very complimentary way over a qualitative insight as to how staff and teams are immersing themselves in the learning, so that informs their practice, and how can we be assured that the practice is actually right, because I'd like to hear directly from carers. Anyway, there you go. Answer. Sorry.
That's okay. I'll have a go. So yeah, I think around that first point around the data, absolutely. And that's, I think, as we kind of mentioned, something that we recognise as a system that we want to get far better at in terms of having more kind of comprehensive data in place. So that's why we're fairly well advanced now with this project we're doing across NEL, which will basically pull together currently disparate data sets. So as Debbie touched on, we're in a situation here where we've got a whole load of data around carers that sits within our own LBN databases. So our ASIAS Care case management system has a record of a number of carers. We then have a separate list of carers that sit within EMIS, which is the health system. We also have another set of data from our commission provider, who's working with carers. But at the moment, we can look at those data sets and compare them in an anonymized way, so we can see that there's different numbers. We know they're different, but what we're working on at the moment is that next level to that project, which is to do the line by line matching, which will help us to understand fully whether we're looking at the same sets of data around carers or whether they're different. And it will also enable us to be far more forensic in the way that we look at some of the demographic data, some of the demographic profiles. Might even help us, once we've done that matching, to fill in some of the data gaps that we may have in different parts of our systems. as you can imagine, there's quite a lot of information governance that we're going through around that at the moment. But I think the foundations have certainly been built with the discovery team at NEL. Had a great meeting with the team over there last week, chaired by Charlotte Pomeroy, who's the carers lead at NEL. And they were talking again about what a priority this piece of work is, and that actually, if we do this piece of work in Newham, then that will be the first place that it's been done across our system and across NEL, and that there'll be an opportunity to share the learning from that across the rest of the partnership, which is really exciting. Obviously, that will be really great to have that piece of work done, but it will still, as you quite rightly pointed out, only tell us more information about the carers who we currently know about or who are currently receiving health or social care services. So that's where a big part of the strategy and work we're doing in parallel, so we're not doing it one after the other, is all about how we really reach out into our communities. And I would absolutely welcome any evidence-based advice or research around how we can do that, and it'd be great to kind of get any advice there. But we're talking about various campaigns reaching into different communities. That's why we've got a commission provider now that we feel has a far better affinity with our Newham population, more kind of culturally competent in terms of already having really good links in with a lot of our existing communities, because it's a consortium of 3 local providers. So we feel quite encouraged that they'll be able to reach into communities more effectively. We've also got, on your point on young carers, a whole programme of engagement work within our schools to reach out and help identify young carers in school settings and feed them into support services. So yeah, still loads that we need to do and loads that we can be doing. But yeah, hopefully that's answered the 2 points that you made. Oh, sorry, the next bit was around practice development. Would you like me to go on to the practice development question?
Yes, please.
Okay, so yeah, as it says, I think it's probably a bit hidden within the appendices of the report, but you'll see, hopefully there's quite a lot of actions in there around looking at just this point really about how the practice that we deliver, whether that's our social workers within adult social care. So we're doing a whole review at the moment around the carers assessment process within adult social care. We're refreshing our training for practitioners, and carers themselves are involved in co-producing that training and delivering that training around carers assessments. So there's a whole work stream on your document. It's that kind of work stream 2, I believe, for adult social care, that's very much looking at our practice. It aligns a lot with our kind of CQC assurance. There's lots of talk in there around supporting carers and how we need to do that effectively. So there's a lot of work going on there. In terms of practice within health settings, Debbie touched on one of the main things that's happening there, which is around, for example, the hospital discharge toolkit. And the group at the hospital that Tom's leading on are looking at how that can be embedded and how we can look at best practice for health staff as well, about how we both identify carers, and then once we have, how we support them to navigate the system, to access services, etc. So yeah, again, I think there's lots to do in terms of practice, but I think we have got some of the kind of main building blocks, I suppose, in terms of how we want to improve practice threaded throughout the strategy.
All right, super, thank you very much. Are you satisfied with that? All right, great. Is there anything that we need them to come back to us on?
Well, I think it would be good to hear voice of carers giving back into the board. It would also be good to understand what proactive work is being done to identify carers who do lots and lots of work and how they're being supported to look at substance and reimbursement because allowances and stuff like that. It may be a bit too much operational detail, but actually I think it's part of the broader wellbeing approach.
Is it possible to coordinate with suitable, with carers that would be comfortable, even if we had to do that in a closed session element, or if not the next meeting? I mean,
We've got an advisory group for the strategy, so I would have thought that would be
Yeah,
Yeah,
I mean.
Yeah, I was just about to come in with that, Jason. Yeah, we've got a meeting of our Carers of Resident Advisory Group actually Wednesday evening. So that's a new group that's shown in the document as well that you've got, which shows how they're kind of almost sitting strategically alongside the delivery board. And we're actively growing that RAG group. So yes, that will definitely be the intention. Is that's how we'll be keeping the voice of carers really embedded as we co-deliver and co-design. But if there's something that you'd like us to bring back with carers, we can certainly look into that. Do that.
Well, could you actually, if you're meeting them later this week, could you ask if they would be willing to consider an invitation to come and speak to us at either the October Health and Wellbeing Board or the one after that, because we'd like to hear from them firsthand and have the opportunity to ask them questions so that we get the additional layer of assurance from them directly.
Yes, of course. Yeah, we can table that on Wednesday's meeting, no problem.
Brilliant. Thank you very much. Right. I don't think there are any more hands up, so I am going to now move on to the recommendations. Recommendation: note progress and support further work to align place-based activity at the Northeast London systems level. And then you've noted the action, haven't you? Pauline.
Oh, yes.
All right. Okay, do we know that, everyone? Okay. Great. Okay, let's move on to agenda item 8, which is development of a local action plan towards a smoke-free Newham by 2030. And we have a presentation, I hope, by Elizabeth Owen, our lead public health strategist, and Madalena Pop, Commissioner. I bet you get lots of comments on the POP. I'm sorry. No, because you know what it's like when someone clicks up on your name and you're like, oh, gross.
are you going to share your slides, Lizzie, or do you want the?
I'm happy to share the slides.
Yeah.
Yeah, I'll do that.
Over to you. Welcome.
Thank you. I will just do that. Oh, I need to have sharing rights.
Okay, 1 second.
That's done.
Yeah,
Done.
right, she's done it.
Great. Okay. Can everyone see that?
Yeah, you can.
I'm sorry, there's the wrong date. It was for the previous meeting, but all the slides are as they should be. Okay, so this is just a summary of what we wanted to set out in this update and recommendations today. So we just wanted to very briefly highlight some of the key activities and achievements towards a smoke-free Newham since 2020, our next steps towards this goal, and then some key asks for the Health and Wellbeing Board. There's 2 of those. One is to champion and sign the local government declaration on tobacco control. And I think that will really help Newham to really champion and set out the commitment that we absolutely are demonstrating to reducing smoking prevalence and health inequalities. And then we're, as part of our next steps with our Smoke Free Alliance, we're going to be drafting a local action plan. And we'd really like that to be sort of overseen from a governance perspective from the Health and Wellbeing Board. So we really like to bring that draft local action plan. And we'd really like colleagues on the Health and Wellbeing Board to really champion that through their various organisations, because it's so important, and it's been demonstrated through our work so far, the importance of that system-based approach. So just a bit about our tobacco profile in Newham. So smoking is currently the biggest cause of death and illness in Newham. In 2020, adult smoking prevalence fluctuated due to external factors like COVID-19 pandemic. But in 2021, our adult population of smoking was 13.9%, which is still higher than the London average. Newham has the 5th highest prevalence of smoking out of the 33 London boroughs. Interestingly, for pregnant women in Newham, smoking status at time of delivery is 4.5%, which is actually much better than the England value at 9.1%. So what are our ambitions? So priority 10 of the Newham Health and Wellbeing strategy is to make Newham tobacco free by 2030. So when we talk about being tobacco free, that means it includes not only things like cigarettes, but actually chewed tobacco and things like shisha. And we want to reduce smoking prevalence to 5% or less in the borough. So we still do have some way to go, but we've made some really good progress. We want to provide access to high quality support to quit smoking, to develop a local smoke-free action plan, and to incorporate the Well Newham values across this priority, but also our future health and wellbeing strategy. So just a few key activities and achievements. So we completed something called the CLEAR assessment, and that's essentially you benchmark against certain evidence-based sort of objectives. And we actually did that alongside Hackney. So they peer assessed our assessment, which was very effective in making sure that we were sort of answering all the questions. And that was done across the system. So colleagues in Barts, colleagues at Elft, colleagues within the council, whether you're in trading standards, schools, everyone sort of completed this assessment. And we actually identified a report or prepared a report of the findings. And very much you use the findings to inform our local tobacco control plan. So that CLEAR assessment really helps you to see what are you doing well, what could you be doing better, what could you be doing more of. So it's a really, really effective tool. We set up the Newham Smoke Free Alliance back in January 2021. Conducted targeted operations of underage tobacco test purchasing, underage illicit tobacco test purchasing, and illicit tobacco enforcement. And all of that work is so important for the prevention of uptake of smoking and vaping, particularly among young people. And we've developed a young people action plan on smoking and vaping. So just a little bit about the action plan for preventing uptake of youth vaping. So Healthy Schools Smoking and Vaping Toolkit is being piloted in a number of schools in Newham. A vaping fact sheet for teachers and parents has been published. Some really good co-production with young people via the Head Start Youth Panel, but also most recently at a pupil referral unit, and some trading standards business cards enabling individuals and schools and other organisations to anonymously report and share intelligence of retailers selling illicit vapes to underage users. Maddie, I wonder whether you just would like to present these next couple of slides as the commissioning lead.
Good evening, everyone. I'm Adelina Pope, Public Health Commissioner, and I'm the lead commissioner for smoking cessation, specialist service, and in pharmacy. From January 2021, Queen Mary University of London has been commissioned to provide a specialist stop smoking service in Newham. Prior to this, we didn't have a specialist service. Since the specialist service began, the numbers of residents quitting has increased significantly, and the council has been instrumental in developing and maintaining a multi-agency approach to the wider tobacco control agenda across North East London. Newham's Newham work around smoking cessation was recently recognised at a national level by the charity ASH, where the Nail Tobacco Leeds Network was presented as one of the best examples of regional tobacco control network in England. In addition to our specialist service, we've had 45 community pharmacies providing smoking cessation work from 2016. However, since the specialist service came, we've had an uptake of excellent 4-week quit rate. So the analysis of service level data in 2022 indicated that Newham had a 59% quit rate, which is a very, very good quit rate in line with the NICE guidelines. The service uptake is on an increasing trend, year 2 being approximately 24 years more successful than year 1 in terms of quits and registrations. We managed to increase registration and quits in the service from 12% to 17% in priority groups with historical low engagement in the service and high smoking rates, for example, Virgin manual workers and Eastern Europeans. And we've done this to tailor methods and targeted outreach. We created very strong pathways with inpatient, maternity, mental health and substance misuse services. We opened smoking cessation clinics in Southeast Newham in areas with high smoking rates and quite deprived areas in Newham. And as a result, at the end of 2022 and 2023 financial year, numbers of quits and registration increased in those targeted areas in Newham. We've got an excellent qualitative feedback from residents as well. Yeah, the feedback is positive, both quantitative and qualitative.
Thank you so much, Maddie. And there's also been some really good achievements in terms of how we promote the service. So delivering health promotion campaigns, targeted work during National Stoptober campaign, and developing, as Maddie talked about, that multi-agency approach. So just a bit about our next steps towards a smoke-free Newham. So we're going to be delivering the Young People Action Plan on Smoking and Vaping. With our Smoke-Free Alliance members, we're going to be developing a local smoke-free control plan focused on preventing uptake, promoting quitting and treating dependence. And we'd really like Newham to sign up to the local government declaration on tobacco control. And these are our key asks. So the first is that we ask the leader of the council, our chief executive and director of public health via the Health and Wellbeing Board to review the local government declaration for tobacco control. I think that we can see from the work that we presented today, this evening, that we're already doing a huge amount demonstrating our commitment to ensuring tobacco is part of our mainstream public health work. And I think this is a really good opportunity for us to sort of showcase that publicly. And then the second ask is to review, once it's in draft form, our local smoke-free action plan. So already we have met with our Smoke-Free Alliance to identify people who would like to participate in a task and finish group to develop this local action plan. And we're going to begin those monthly task and finish group sessions in September with the aim of in the new year refining that sort of draft action plan and hopefully bringing it to the Health and Wellbeing Board. So thank you very much, and we're really happy to take any questions or comments.
Brilliant, thank you very much. Right, so I'm going to open up to questions. I can see one in the room already. Councillor Joshua Garfield, over to you first.
Thanks, Chair, and thanks for that presentation. It was really useful, and I think that the figures are, although we're higher than the average among them, which is less than ideal, and of course these steps will go some way to getting us, further down that list. It's lower than most people probably would make an assumption on, and that's something that is a testament of, I think, the past 30 years of public health policy with regard to smoking prevention, which took a lot of really, really brave political decisions, and I'm very glad that they are actually showing fruit in this regard. I wondered, given the reference to debates, particularly the £250,000 of illegal vapes being taken off high streets, do we have any statistics on how much of Newham population currently vape, including potentially if data has been collected on how many young people under 18 taken up vaping?
Yes, so we do. I can probably answer part of this question. So we do, the ASH organisation that Maddie mentioned, their Action on Smoking, they actually produced some data last year, national data on young people and smoking, and it demonstrated that young people are increasingly trying vaping. Most young people are trying it to experiment, but they are seeing quite an increase, and that therefore has caused OHID and other local authorities to really take note of that and to really be looking at it and thinking, okay, we need to be on top of this and understanding more. We have collected some data locally. So there was something called the SHOE survey that was shared with primary schools last year. And that also identified that even primary school age children have tried vaping. And then there was another survey that was done by head teachers quite recently, which actually asked them their perception of what they see as, whether they are seeing increased use of vapes on school sites. So we do have some data. I'm very happy to share that afterwards as a follow-up, so you've got some exact figures. Part of our action plan has been so positive that we're now working with Bart's Health, for example, as well as other services like safeguarding, to actually make sure that we are recording data on young people and vaping. So, for example, Bart's have actually now started included vaping as one of the sort of things that a clinician can select, particularly for sort of any vaping associated admissions. So the Young People Action Plan has been a really good way for us to see, okay, what data do we have? Oh, look, there isn't actually as much as we'd like. Let's work with partners to make sure where we can collect that data, we are collecting it. And we've been sharing that actually with not only North East London boroughs, but also at the London Tobacco Alliance, because I think we're one of the only boroughs who's actually really looking at that, which is really positive. In terms of adults vaping, I'm actually not sure. I'm sure there should be data on that. I think what we also need to distinguish, though, is that whilst the guidance is very clear that we have to deter young people from taking up vaping, actually on the other side of this, the evidence is also very clear that vaping is a really useful tool to support adult smokers to quit, and actually is very effective. So our Quit Well Newham service do offer, among other therapies like nicotine replacement therapy, and of course everyone's supported with behavioural support, but they do offer vapes. They're obviously regulated vapes, so they're not the illicit ones that you can get elsewhere. They're ones that are registered by the Medical Regulatory Authority. But just to note that distinction, and it is quite a difficult and challenging comms to deliver, because they do seem a bit conflicting. I don't know, Maddie, whether you've got anything to add.
Yes, exactly. So the vape we use in the service, it's a non-branded, not colourful, not attractive. It's purely for treatment. And we have to make this distinction between the attraction of those vape shop that looks like candy shops really, and the vapes we use in the service that are purely for treatment and are ordered by the service through an supervised platform from a non-tobacco company. That's very important to mention as well.
Okay, yeah. Brilliant. Yeah, over to you.
So this is really helpful, thank you, and congratulations on your work. Do we have a sense of the different sections of Newham's population in terms of that 39.9% of the adult population smoking? It would just be interesting to have a breakdown in terms of the demographic profile, because also there has been well-established research about multi-generational smoking habits as well. So it'd be really good to just get underneath some of that information, just because of the richness of Newham's population.
Yeah, Maddie, I wondered whether that's something you'd like to talk about with referring to the sort of high priority groups that we understand within that adult population. I think that might be helpful here.
Yeah, so in our service, and we've kept saying for the new contract, and this is obviously recommended by the NICE guidelines, we actually 85% of our service users are from priority groups. Priority groups, our priority groups are routine and manual workers, Eastern European, pregnant women, mental health, residents from deprived areas of Newham as well, and residents with multiple underlying conditions. And as I said, yes, the quit rate actually is even better in priority group than in the general population, because what we do in the service, we focus on those groups and we tailor our outreach. We've translated flyers in our most spoken languages at home, Urdu, Bengali, Romanian, Lithuanian. So we've translated, and we've actually went to settings where they feel comfortable. So we've tried to tailor and actually have a friendly face towards residents, so they can trust and have a mutual relationship actually with the advisors as well. I'm not sure if
Yeah.
that answers or.
I think also some of your referral pathways. So Maddie's developed some fantastic referral pathways with other services. So ELF for people with serious mental health conditions. So there's now a really good pathway, and they're a high priority group within that population currently smoking. But there is now, which there wasn't before, a really good pathway between their inpatient smoking cessation support and our community Quick Well Newham service. And I think that's really positive.
Yeah. Okay, anything else? Yeah. Jason Struggles.
So I just wanted to thank Lizzie and Maddie for your leadership on this issue, and just to lend my support for the two asks of the board, which was around the local government declaration and the board having oversight of the emerging action plan for smoke free. I think that would be really valuable. It requires, you know, all of the evidence, like many public health issues. It requires a whole system efforts. So, you know, all the different representatives around this board, from education to other parts of the council to the secondary care trust, primary care, everyone. So very supportive of those asks.
Okay. I've got just a couple of quick questions, and thank you very much for that. And I'm sure everyone will concur with the sentiments and the thanks expressed on the youth vaping piece. Noting the toolkit being piloted, can you just talk me through how that was developed and the process of evolving and finessing that following the findings that emerged from the pilot, and then what are the ongoing plans to continue with the involvement of young people in any future iterations, and how are you, and just in terms of the pilot, how big is the sample base? Where is that drawn from in terms of where this pilot toolkit? How is the toolkit designed? Where is it being trialled and piloted? What's the kind of pilot sample base? And then in terms of things emerging during this pilot phase, how much of that is subsequently being tested in different youth cohorts? And what's the depth and scale, even within the pilot, with the council's youth empowerment team, as well as the wider school community? Albeit I appreciate that we're entering into the summer term, but just noting the timeline as well.
Thank you so much. I can certainly try to answer some of that. We might ask if we can provide some of the information in a written follow-up after this meeting, if that's possible, so that we can consult with our Healthy Schools team, because the toolkit has been delivered as part of the Healthy Schools initiative, and I'd quite like the opportunity to get some more detail from them, if that's okay. But I can certainly talk about sort of how it's been designed and the role of young people and working with schools. So initially it was actually head teachers who came to us, to public health, noting their concerns about vaping and seeing an increase anecdotally. And there was a group that a couple of head teachers had set up. And we sort of, with our task and finish group, we sort of merged those groups, and as a result we had many more schools, either via the head teacher themselves or their designated safeguarding lead, attend our task and finish group, which was where we were determining what should the actions for this plan look like. So in designing the Healthy Schools Toolkit Silver Award, it was very much done in partnership with those schools. And I think there's 2, perhaps 3 schools that are piloting it, but I can get that confirmed. One of them is the pupil referral unit at Tunmarsh. They've been very actively involved in this. And as part of the action plan, we actually went to Tunmarsh and did some really good persona workshops with the young people there. And we plan to go back again in the new term to go and sort of continue that conversation with the young people to help in the continued informing of our work and the toolkit. So our Healthy Schools lead, Amy Hayfield, is working directly with schools around the pilot, and there'll be opportunities for feedback within to it to see, are there things missing, are there things that could be different? I don't think probably findings will come from it until later this year. There's quite a lot involved in the toolkit, but I can find out those much tighter details for you, of course, after this meeting this evening.
Thank you very much. That would be really helpful. We can get it circulated to our board members. And then just one thing to flag, just given the fact that it's largely been restricted to 3 schools from the school community in the pilot, including one of our alternative provision institutions. I think it'd be worthwhile, and I'd have to chat with you offline and the team, to use the summer period, particularly with the Youth Empowerment Service, because you'll capture quite a broad range of demographic to see if at this stage, well, at this point of the pilot, it's worthwhile socialising some of the toolkit and get some feedback from the young people that access our youth zones, because we've got a range from 10 all the way through to 25 with special educational needs, and also engaging and getting some views from our youth workers as well.
Yep.
Yeah, different types of relationship to teachers and educators within the formal educational landscape, and could provide some quite useful insights as well.
Yeah, that sounds great, and we'll absolutely do that. Thank you.
If you just drop me an email, then I'll link you
Yeah.
up.
Yeah.
Okay. Are there any other questions, colleagues? No, and I'm going to just draw everyone's attention to the recommendations of big page number 55, which is the board is asked to have governance and oversight of the development and delivery of a local action plan for tobacco control in Durham. Also, we recommend that the Health and Wellbeing Board endorses the local government declaration on tobacco control. Do we agree that in the room? That's agreed. Okay. Now, before we jump on to agenda item 9, which is the Learning Disability Action Plan, we'd just like to formally welcome Councillor Sarah Lewis to the meeting. Thank you, Chairman. Okay. Right. I'm delighted that you are here. Right, sorry, Gil.
In view of the time, did you want to?
Oh gosh, yeah, talk to you much. Okay, colleagues, let me just see how everything.
Got 2 more items on the agenda.
Do you reckon 15 minutes?
I think let's try and do them quick fast present. Otherwise we may end up deferring one, and I think they both.
Yeah, no, we can both do. Yeah, I think so. Yeah. Colleagues, are you? We're proposing to just evoke a instrument to extend the meeting by an additional 15 minutes, so that we can conclude the agenda items. And we're going to agree on in the room only, only because you're all online and you don't have a vote. So, do we agree? Yeah, we agreed. And colleagues that have to leave from Zoom, by all means, do so, unless you're presenting on the last 2 agenda items. And I would urge people in the room not to, please. Okay. Right. So let's go on to the Learning Disability Action Plan. And this is going to be presented by colleagues Helen Murphy, Senior Commissioner, Adults and Health, Robin Betts, Clinical Service Manager from the East London Foundation Trust, and Lydia Drummond, Assistant Director, Commission, Adults and Health. Over to you, Laura.
Thank you, Mayor. So we've actually had apologies from Lydia. She's actually on annual leave at the moment. So it's going to be myself and Robin presenting this item. So I'm Helen Murphy, Senior Commissioner from Adults and Health, and I'm going to be introducing the action plan and then covering a couple of the year 1 highlights, and then hand it over to Robin to continue with that. and also look at some priorities for year 2 of the plan. So this plan actually covers 2022 to 2025. So really the purpose of the plan, we've co-produced and published a Learning Disabilities Action Plan to raise the profile of adult residents in the borough with a learning disability, to increase community awareness and inclusion and reduce inequalities, and also to improve support for adults with a learning disability to live healthy, safe and fulfilling lives. So we've published a full version, which is in your packs, and also an easy read version for residents with learning disabilities, and also produced a video which features residents with a learning disability explaining the 6 work streams and why they're important to them. And I do encourage the board to have a look at those videos. There's a link included at the end of the report. It's around about 11 minutes long, and the videos contain some really powerful messages from our residents. The actions in the plan will be driven by a newly formed Learning Disability Delivery Board, and that's also co-chaired by a resident with a learning disability. It will also oversee some newly formed learning disability resident advisory groups. We want that group to consist of as many residents who are interested. There'll be quarterly meetings with a forward plan to discuss items in the action plan, or these can be wider. So we also have across the ICB the Newham Learning Disability and Autism joint planning group, which the Delivery Board for Learning Disabilities will report progress to. So the number of adults with a learning disability currently living in Newham is estimated to be over 6,000, and this is expected to increase to over 7,000 over the next decade. In December, December 2021, as part of the development of this action plan, the council engaged with residents with a learning disability via a citizens' assembly and their carers to ask them their views and experiences of living in Newham, to better understand from them what's working for them and areas for improvement. So the plan's been largely shaped by the resident feedback received, also feedback from health and social care professionals, including the providers, support providers who support residents, and also by national and local policy, and by an outcomes framework. So there are 6 work streams, and they've been very much shaped by residents with learning disabilities, using I statements which are included in the plan. And these are the high level outcomes that we're aiming to achieve. So we've got heard and valued, accommodation and housing, connected and involved, work and purpose, health and social care, which is the largest section, and a carers section as well. And then we've got various actions beneath those different work streams. So progress on the actions beneath those work streams, we're monitoring via a we said we did document and dashboard, which is currently under development. We would have liked to have included it in the packs, but it's still being developed. But that will then be reported via the governance process that I mentioned. So just wanted to quickly cover a couple of the highlights that have been achieved in year 1. So in March of this year, we held our first World Down Syndrome Day event. That was attended by Councillor Wilson held in Newham Leisure Centre. It was a really great success. We feel we can probably do better and increase resident participation next year. We've also developed the Independence to an Ordinary Life project, and that's funded by the ICB in partnership with the council. And it's a project to support younger adults with learning disabilities to be less reliant on services. So in year one, an occupational therapist worked with 30 younger adults for 12 weeks to support them to increase their and develop their independence goals, such as showering and personal care, travelling, shopping, making meals. There's plans to continue that work in year two via the in-house community opportunities team. We've also done some really good work around improving the co-production and self-advocacy offer for adults with learning disabilities. The engagement was particularly poor for residents with learning disabilities throughout the pandemic. It's been quite challenging to turn this around. But as year one saw the development of that new governance structure across the ICB, with the joint planning group, the delivery boards and the resident advisory groups, we've now got a separate resident advisory group for carers, strengthening the residents' voices, and also a new organisation delivering non-statutory advocacy. So I'm just going to hand over to Robin now, just to cover a couple of other highlights and also talk about some priorities going forward.
Hi, so my name is Robin. I'm the manager of the Newham Health Team for adults with learning disabilities. So just looking at some of the other year one highlights, we've trained over 200 health and social care staff in learning disabilities and autism awareness and positive behaviour support. We have 2 learning disability community nurses that are working closely with GP surgeries, improving the number of the quality of annual health checks for people who are 14 years into adulthood. We're also doing a lot of work around cancer screening programs across Newham for adults with learning disabilities, with at the moment a particular focus on breast screening, which we know currently sits at around 28% for women with learning disabilities. So the 2 nurses are helping to create easy-read information, arrange longer appointment times, looking at how we can adapt equipment, but also actually supporting women to attend the appointments, and hopefully helping to make this a more meaningful and comfortable process. Going into year 2, we'll be looking to use some of the health inequality funding to employ a peer support worker who work both with autistic adults and residents with learning disabilities. And they'll hopefully be able to help us to develop more peer support groups, obviously to work within different communities to raise awareness, but also to kind of help people to feel less isolated and vulnerable, and help people to increase their own independence. We'll be looking more at supported accommodation for adults with learning disabilities via the supported living dynamic purchasing vehicle. And we're also hoping to develop a kind of business plan which would align the health teams and the local authority for us both to have similar eligibility criteria, which would also then bring us in line with other North East London learning disability teams. And then hopefully we could deliver a more equitable service for people with mild and moderate learning disabilities. Some of the challenges, I think, looking across both health and social care, recruitment remains a real challenge. I'm speaking on behalf of health. Learning disabilities obviously is a very specialist profession, very competitive, and I think some of our the colleagues in younger adults or children's services have mentioned that it's particularly hard recruiting at the moment people into kind of psychological therapies. But yeah, hopefully we're getting there. But yeah, it's I think that's going to have to be a longer term strategy to kind of keep Newham competitive in the marketplace.
Thank you very much for that. Just on that last point, keeping us competitive. What in your mind, Robin, do you think is impeding that? Are we not having sufficient sort of strategic thinking discussions?
I mean, I think with regards to health, I'll be honest, probably a very easy one area might well be to do with finance. Newham is an outer London borough, whereas if you look at our kind of the other two ELF learning disability services in Hackney and Tower Hamlets, they're both inner London. So obviously, even though kind of as the crow flies, it's not a long distance to travel. They obviously have they're obviously paid slightly higher wages. I think Newham, working with learning disabilities, there are real challenges in Newham, but they're real opportunities. And I think with the team we've got, people really appreciate that. It's such a diverse borough. But it's a really exciting place to work, especially for young practitioners. You can learn so much in Newham. But it's just getting people in and helping people to realise that and to realise how much it's got to offer. So yeah, it's as I say, I think word of mouth is really important, across health systems. And I think Newham hopefully has got a really good name for itself. But yeah, I just think it's a challenge at the moment across the board.
Okay, thank you very much for that. Are there any questions, colleagues? I've got Sarah Ruiz.
Yeah. I'm very interested to know how much resources you put into learning disabilities in Newham. I would also be interested to know what actual provisions are funded or provided. It's all very well having a strategy, but actually how, I fully understand that we need to reach more people, but actually what are we actually doing to reach more people, and what are we doing to provide them with opportunities to socialise or get employment or whatever?
There is an employment section in the action plan, Councillor Ruiz.
Yeah, I've got the action plan, I just don't necessarily understand that in the plan and the reality are the same things. To be perfectly honest, I think we have people who go through to our employment coaches or whatever and spend 6 or 7 weeks there and come out with a very nice certificate, but no job. I mean, and that may be reality, but don't promise what you can't give.
I think we do recognise that that's an area that we can improve on, and we've recently recruited a new commissioner for supported employment. So it's an area that we will be working on going forward in year 2.
Thank you, Helen.
And can I suggest on that point, and also on the workforce planning, outside of this meeting, there's relevant conversations within the relevant forums, and then if not at the next meeting, the subsequent meeting later this year, we come back with an update with more detail. And I think similarly, as we've requested the members of the Residents Advisory Group that help inform the strategy are invited to come and present so that we can ask them direct for assurance purposes, and we'll capture that as actions. I'm gonna ask if we can just note the recommendations and then move on to the last agenda item. Thank you very much for that, officer colleagues. The Health and Wellbeing Board is asked to note the action plan, the progress implementation via the reset meeting document and dashboard, and support its ongoing promotion and implementation, particularly to residents who may be interested in joining the Residents Advisory Group. Is that noted? Noted. All right, super. And then the final agenda item is the concordat. Concordat? Is that how you pronounce it? Concordat. Concordat. Mental health and wellbeing prevention concordat. Right. 30 seconds to introduce it, and I'm going to have to defer this to the next, unless I defer this to the next meeting. Michael, go on.
I think my fear is I was going to introduce it for 30 seconds. I'll do my best job. So the Prevention Concordat for Better Mental Health is a national initiative which is very much encouraging through various directions of travel around greater emphasis around prevention, making sure that we're working across wide determinants of health in terms of integrating mental health support, building our capacity and across the workforce to support mental health and wellbeing. But very much following COVID, there's a great sense that we need to strengthen our community-led action around mental health and wellbeing support. And as part of that, we were successful in gaining 400,000 for community-led mental health action, as called the Better Mental Health Fund. And as part of getting that money, we agreed that we'd be very happy to sign up to the commitment of the Concordat. And that was agreed at the Health and Wellbeing Board in May 2021. So this is very much us coming back, saying we've completed our submission. We feel we're at a really good point to have done that, in the sense that we're coming to the end of our 3 years of our health and wellbeing strategy this year. And it's a great way to recognise some of the whole system working we've done around mental health and wellbeing, but also our commitment to continue being very much community focused and led in our response. That's all I'm going to say, because I've got some great partners here to talk to about the work that we've done that we'll all do fairly succinctly. So if I hand over to Fiona to maybe give an overview of the different domains it covers, and then to partners.
Sorry, I just need to rapidly ask the board if they agree to note the report, the recommendation. Yes, agreed. All right. Support new submission to the Prevention Concordat for Better Mental Health. Yeah, agreed. Yeah. That's agreed. Carry on. Sorry. Who is it that you wanted to introduce?
So I was going to pass on to Fiona, and then
Well, I'm going to be even quicker. I was going to take you through the domains of the Concordat, but you've got that in the pack that you were given. So we can always take questions should you want to stay in the room even longer around that. But I think the really important thing, and as Laura said, that we wanted to stress the kind of the systemic and partnership approach that's been taken to kind of mental health and well-being as a result of the work that's been done initially from the mental wellbeing impact assessment that was done in relation to COVID, and then some of the funding that we got from OHID in order to kind of put in projects around mental health and mental wellbeing. And we've specifically asked Task and Salim from the Subco Trust just to come and give us a kind of quick update on what her organisation has done, and also what it's meant to her organisation. So there's kind of what it's done for our residents, but also how that's managed to develop Subco Trust as well. So if Taskin can kind of give us a brief overview of that, that would be fantastic.
Please do, Taskin, welcome, and apologies for the long wait. I hope you haven't been sitting there. I bet she has. No, I'm sure they would have been polite to bring her in at the appropriate point. No, I bet she's been. Oh no, don't do that.
Okay, Councillor Sarah Ruiz, I know you too well.
Yeah. Tasking over to you.
All right, thank you very much. I'll be very, very quick because I know it's been a long evening, and thank you very much for inviting me. I think it's probably best to start just very quickly to say pre-pandemic, we were struggling to do some work around mental health, but because of the pandemic, unfortunately, we were able to come together and form new partnerships, both within the council, but within other organisations within Newham, to come together and develop a service around befriending and connecting Newham residents with services. And the biggest thing that we were able to do was around Connect Newham, the telephone befriending service, which then led on to a face-to-face befriending service. And we worked in partnership with Age UK East London, the Renewal Programme, and the commissioning team within mental health. And I think the biggest thing was how we were able to get together and understand and trust each other, look at real collaborative working, making sure that we were able to meet all our residents' needs, from very young people to older people, and be able to forge new partnerships, which then led Subco then to go on and get some 3-year funding from trusts outside of London. Sorry, not outside, like outside of Newham, sorry, for 3-year funding around mental health and wellbeing, older Asian elders and carers. And I think it just shows that the voluntary sector, if we work well together with yourselves, we can pull in very exciting pieces of work, extra funding, and look at how we can then work together to extend that forward. And I think what we've also shown is that we've been able to work with very small organisations as part of the Connect Newham programme and support them to increase in their understanding around mental health, how to provide services both on a face-to-face level, but also in terms of strategic level, and being able to, support them to do very basic things like put policies and procedures together, how to apply to the Charity Commission. And with the partnership work with over 6 small organisations with Newham. So as well as working on frontline work on one-to-one with residents, it's very important to enable the capacity building around smaller organisations, so they're in a position to carry on developing and providing that sustainability. And I think I'll stop there, if that's okay, unless there's any questions.
Thank you very much. Are there any questions, colleagues? No? Okay, fine. So we've already approved it. I'm just really sorry that we haven't had a chance to really go into it in detail. But can I also similarly, if I'm noting that the submission of a concordant takes place in August, panel presentation in September, and then there'll be feedback. And if that feedback, we can add it to the agenda for October.
Yeah.
Yeah. And then we'll get it early into the agenda in terms of arrangements. Okay, thank you so much, everyone. Thank you. All right, it's been a really interesting session. It's very interesting. Yeah. Anyway, right, we're concluding this meeting, and thank you to members of the public and media watching.